All right, welcome to the fourth of 8 webinar series in the Project Firstline Infection Prevention Essentials webinar series. My name is Christina Boyd, Director of Quality, Patient Safety, and Health Policy at the Illinois Health and Hospital Association, also known as IHA. As we are going through a handful of housekeeping items, we do encourage you to complete the poll that is open on the right-hand side of your screen. Results from this poll will only be seen by presenters and not shared with other participants on the line. If you're not seeing that poll, it is likely because you're in full screen mode. So just please press Alt-Enter at the same time, and that poll should be visible in the bottom right-hand screen. Also, after you've selected your answers, please be sure to click the Submit button so that we receive your answers. Before we begin, I do have a few announcements for you. Due to the large number of participants on the call today, everyone has been muted. We will have lots of opportunities for discussion during different segments of today's presentation, as well as during our breakout session today. So when you are ready to talk, you can go ahead and take yourself off mute by clicking the unmute button on the bottom of your screen. If you are only called in on the WebEx, or if you are not only on the WebEx piece and only called in on the phone, you can press *6 on your phone to unmute your line. Finally, I do want to make you aware that this webinar is being recorded and that by attending this webinar, you are considered to have consented to being recorded. If you do not want to be recorded, please exit the webinar now. A copy of the slides and the recording of the webinar will be shared with all registrants following today's presentation and posted to the Chicago Department of Public Health Healthcare Associated Infection website. Again, I want to welcome you to the fourth of 8 webinars in the Project Firstline Infection Prevention Essentials webinar series. This series is intended for all frontline healthcare personnel, regardless of infection prevention training or background. These sessions will provide foundational knowledge you will need to be able to confidently apply infection control principles and protocols necessary to protect yourself, your family, and your community. For this webinar series, we will be utilizing educational materials from Project Firstline, which is the Centers for Disease Control and Prevention's collaborative aimed to provide infection prevention training for frontline healthcare personnel. Today's session is accredited by the state of Illinois for up to 1 hour of nurse continuing education credit. Only those attending the live session are eligible for continuing education. Following today's webinar, you will receive a survey via email, and you will need to complete all of the required fields within that survey by Tuesday, May 24th in order to receive your continuing education credits. And that does include entering your nurse license number in the required field. If there are multiple people in the room with you today, please be sure to forward that email with the survey link in it to those with you today so that they can also obtain their continuing education hours. Within 2 to 4 weeks following the close of the survey, respondents will receive their continuing education hours from IHA staff. All participants in today's session will receive a certificate of attendance indicating your participation in today's session. The Illinois Health and Hospital Association is partnering with the Chicago Department of Public Health to host this series to support your infection prevention training needs. We are also joined by Crystal Bayer, an infection preventionist from Advocate Sherman Hospital, who has extensive infection prevention experience and is enthusiastic about educating peers about infection prevention topics. You'll be hearing from these team members throughout this webinar series, and we do welcome Crystal as part of our team today. The Centers for Disease Control and Prevention Project Firstline initiative aims to provide infection prevention and control training for frontline healthcare workers by supporting their efforts to understand and confidently apply the infection prevention and control principles necessary to protect themselves, their facility, and their community from infectious disease threats. There are multiple components of this initiative, and goals of the project include, first, to conduct an infection prevention learning needs assessment of frontline healthcare workers in the city of Chicago in an effort to identify training gaps and needs. Second, to promote awareness of the CDC Project Firstline infection prevention training curriculum and to facilitate foundational infection prevention training using the CDC's framework for frontline healthcare workers across the city of Chicago. Now, we know that many of you on the line today are seasoned infection preventionists or have had infection prevention training in the past, and you will no doubt find that this content is very basic and truly geared towards those frontline healthcare workers. However, there will be opportunities for discussion during each one of the webinar breakout sessions where you can share your experiences and help our colleagues learn from each other. We would welcome those with experience in infection control to share their knowledge and serve as mentors to those who are in the early stages of learning about infection prevention practices. And then finally, our third goal of this project is to evaluate these training sessions to ensure that they provide meaningful learning opportunities for frontline healthcare workers. With that, we'll go ahead and dig into today's discussion about how source control prevents the spread of respiratory droplets. This slide does highlight today's learning objectives, and by the end of today's session, you will be able to explain how source control stops germs from spreading and why masks are such an important part of source control for COVID-19. First, let's start by defining source control and talking about why it matters. Source control is an important tool to keep germs from spreading. It stops germs at their source before they can spread to other people. Let's start by reviewing the definition of source control from the Centers for Disease Control and Prevention. Source control for COVID-19 is the use of well-fitting face masks or respirators to cover a person's mouth and nose to prevent the spread of respiratory secretions when they are breathing, talking, sneezing, or coughing. Source control for COVID-19 focuses on covering the mouth and nose to keep respiratory droplets out of the air. Wearing a mask for source control blocks your respiratory droplets from being released into the air. A mask should fit well without gaps at the edges and cover your mouth and nose. This is important because people who are infected with SARS-CoV-2, the virus that causes COVID-19, carry the virus in their respiratory droplets and can spread it to other people and the environment. In a moment, I'm going to play a brief video from Dr. Abby Carlson, an infectious disease physician at the Centers for Disease Control and Prevention, who talks about this in greater detail. As a reminder, the video is going to play out of your computer speakers, regardless of how you are connected via audio. So if you are connected on your phone, it is still going to play through your computer speakers. So what we are recommending is that you turn down if you are called in on your phone, that you make sure you turn the volume down on your phone and you make sure that your computer speakers are not muted and that they are turned all the way up. Also, if you have a headset, you'd want to make sure of the same. Volume is up and your computer speakers are not muted. In the event that your computer does not have audio speaker capabilities, we will be posting a summary of the video in the chat, as well as posting a link to that video so that you can watch it later on a different device. So just give me 1 second to pull up that video, please. Okay, so Dr. Carlson shared a great deal of important information during today's video. One of the key points includes the importance of source control to stop germs at their source and keep them from spreading. With COVID-19, as with many other respiratory infections, source control focuses on covering the nose and mouth with a mask that fits snugly around the cheeks and the chin in an effort to keep your respiratory droplets out of the air. Source control is especially important for COVID-19 because we don't always know who's infected, and asymptomatic spread is very common and is actually one of the topics of an upcoming webinar session. Dr. Carlson also shared some great examples of how source control is used in healthcare. As we learned, source control is an important tool used to prevent the spread of infections by stopping the infection at its source. What are some of the other ways that we practice source control in healthcare? Feel free to add those examples in the chat box on the right-hand side of your screen. And if you cannot find your chat box, it is first would be to come out of full screen by pressing Alt-Enter at the same time. And also there is a little bubble at the bottom of your screen, like kind of looks like a comic book bubble. If you click on that, that'll open your chat box up. Distance, yep, that is a good suggestion, keeping your distance. Isolating patients, yep, there is another isolation. Everyone's saying isolation. Stopping that at the source, right? Other ones I know, we talked about bandaging wounds in the video or covering rashes. Everyone's saying isolation. Yeah, covering rashes. Also removing a device, right? So in terms of the urinary catheters or central lines, when an infection is suspected, you would remove that line in an attempt to stop the infection. Covering your mouth when coughing would be another good way to stop the infection at a source, as well as frequent hand washing, right, to get the germs off before they can be spread. Thank you, everyone, for your comments and examples in the chat. We really appreciate that. So source control for COVID-19 is critical to preventing the spread of respiratory droplets. We cover our nose and mouth with a mask to keep the respiratory droplets that we breathe out of the air and away from other people. And why does that matter? This is important because the main way that SARS-CoV-2, the virus that causes COVID-19, travels between people is through respiratory droplets that come out when an infected person talks, breathes, coughs, or otherwise blows air out of their nose or mouth. It is important to stop those respiratory droplets at the source to keep the virus from spreading. So source control is especially important for COVID-19 because we don't always know who's infected, right? Dr. Carlson addressed that in the video. And why does that matter? We don't always know who's infected because people can be infected and not show any symptoms, which is called being asymptomatic. This matters because the virus can still spread from someone who is infected but doesn't feel sick or appear to be sick even. There are other diseases that can spread asymptomatically. If you have some examples, feel free to drop them in that chat box again. Thank you, Laura, for talking about the necessity of those lines before inserting. Good point. I like that. So some other infectious diseases that someone could spread, yep, there we go, MRSA, there we go. Other ones, influenza would be one, we can spread that. I was going to say typhoid. Yeah, typhoid fever was in my notes to say we all remember that story of Typhoid Mary who passed typhoid fever onto a whole bunch of people after she was preparing food, and it got into their food and drink and caused them to be infected as well. Thank you, Bridget. Also C. diff, right? So that can be spread by asymptomatic carriers in the healthcare settings, and that causes significant issues. Yep, measles. Perfect. C. diff, yep, there we go. Thank you, everyone, for, again, sharing those TB comments in the chat box. We really appreciate your engagement in that way. Okay. So now we're going to really shift a little bit and focus more on using masks for source control. So these photos, they're great reminders about why it is important to block our respiratory droplets. Our breath isn't just air, it has a lot of water in it. That's our respiratory droplets, and they come out every time, again, that we talk, sing, cough, breathe, or just sit here and blow air in and out of our nose. That contains respiratory droplets. Most of the time, they are so small, we can't even see them, but they are there. When someone is infected with SARS-CoV-2, the droplets that they breathe out do have virus particles in them. People who are close by can then breathe the droplets in, or those droplets can land on their eyes, nose, or mouth, and they can get sick. Respiratory droplets can also fall on objects or surfaces and be picked up on someone's hands and spread in that manner. So wearing a mask can block the respiratory droplets at the source and prevent the spread of the virus. As we heard in the video from Dr. Carlson a little bit ago, source control protects others. Wearing a mask that covers your mouth and nose can block your respiratory droplets from reaching others when you, again, breathe, talk, sneeze, cough, blow in and air out, right? When it comes to wearing a mask, your mask should fit well without gaps at the edges and cover your mouth and nose. This makes it less likely that your respiratory droplets can reach people and things around you. The mask also serves as a source of protection for you. Looking at the picture on the screen, which you can see in the image on the left, the healthcare provider is not wearing their mask snugly to their face, which makes them more at risk of exposure to the respiratory droplets of others, as well as makes others more susceptible to their respiratory droplets. And now some of you who have cared for COVID-19 patients have used an N95 respirator. Most N95s used in healthcare are also good for source control because they block your respiratory droplets from being breathed out into the air. So not only are you protected from the virus that your patient is breathing out, if you're infected, your patients and your colleagues are also protected from any virus that you are breathing out. So with that, I'm actually going to turn over the remainder of the presentation to my colleague, Jenny Winkler, Director of Quality, Patient Safety, and Health Policy at IHA. And Jenny, just give me 1 second to give this to you.
No problem. Thanks, Christina. And Leanne also put a comment in the chat about the beard lessening the feel of a mask, which I think is something that's very important as well. So with that, we're going to play another video from Abby Carlson at the CDC, who's going to talk a little bit more in detail about N95 respirators and how they work. And so, again, similar to the last video, just some tips to help you guys with the audio. The sound from the video will be coming through your computer speakers. So no matter how you're dialed in, you want to make sure that the sound on your computer is not muted and that the volume is turned up. And then also, if you're using a headset, ensure the volume on the headset is turned up as well. So we will have a summary of the video in the chat box if you are unable to hear, and then we'll also drop a link to the video where you can click on that and try watching the video at the same time as us if you're still having sound problems. So bear with me for 1 moment, and I will pull up this video. Sorry. Okay. All right, so lots of information that Dr. Carlson shared. So just a couple key takeaways from the video, including that N95 is a term given to certain respirators that are tested and approved by NIOSH. And that N95 respirators are made of special filtering materials that filter out 95% of those very small particles, including droplets from the air. So it's important to understand that all masks have some type of filtering material, but they don't all fit your face the same way. And so the NIOSH N95 respirators are going to have the two straps that go around your head to ensure that you have that good fit and that seal that you need. Fit testing is required to make sure that those N95 masks fit your face the way that they're supposed to. If the mask does not, you might be breathing in air through those gaps around the edges of the respirator, and that air won't be filtered, which could end up making you sick. And then again, as she mentioned, most N95s are also good at blocking your own respiratory droplets when you wear them. So any germs that you might be breathing out don't reach or infect others, especially if you have SARS-CoV-2 and you don't know. So just a couple other things. We've talked about source control today, and so you might have also heard a lot about respiratory protection. So we just want to take a minute to walk through what those differences are. So wearing masks in any of the measures that we utilize for source control, those are intended to prevent the spread of infection from the person wearing that source control. And so in the instance of COVID-19, that's masks. So in the event that you are ill or asymptomatic, you are protecting those around you. Source control is intended to reduce the spread of respiratory droplets when you're talking, sneezing, or coughing. And so as we've mentioned a handful of times, and that we'll continue to mention, this of course is very important because it reduces the spread of COVID-19 by someone who's infected but might not necessarily know it. And then respiratory protection refers to respirators like our N95 respirators, which are intended to keep the wearer from breathing in air that contains contaminants, such as droplets from somebody who has COVID-19. So hopefully that provides a little bit of clarification. So in a moment, we're going to split up into 4 breakout groups, and we're going to talk through the questions on the slide. And we're going to break out into 4 groups based on the different care settings that we work in. So we're going to talk a little bit about how we use source control in our daily role, and then some of those challenges that we've encountered with using source control. So each of our breakout rooms are going to have a Project Firstline team member serving as a moderator. We'll have 15 minutes to discuss the questions on the slide. Again, our breakout rooms are based on care settings, so we encourage you to join the group that is most likely or closely related to the type of facility that you work in. And at the end, the groups will come back together. We'll share some of the highlights from our discussion around these questions. And then again, keep in mind that there's a variety of healthcare providers with different levels of infection prevention experience and expertise in your breakout room, so it's a great opportunity for us to learn from each other. So in a moment, what you're going to see is you'll see a pop-up window on the right-hand side of your screen that lists out the different rooms, and that should allow you to select a breakout room. If that does not appear, first you want to make sure you're not in full screen mode. To exit full screen, you'll have to hit Alt-Enter on your keyboard, and then you should be able to hover your mouse over the top of the screen and where you'll see a menu bar. You'll select the menu bar option Breakout Sessions, and then you'll scroll down to the section that says Join a Breakout Session, and you'll see a list of the different sessions available appear when you click through that part of the menu bar. So with that, we'll go ahead and we'll start our breakout session. Thanks.
Okay, here we go, guys. Again, this is a self-select breakout session. We ask that anybody who does have the capability to self-select to go ahead and do so. If you are struggling to do that, no worries. What you can do is, thank you. You can put your choice, number 1, 2, 3, or 4, into the chat bar. So, and I will start as I'm looking at those. I will put you into those. 2. Okay, anybody who is still out there, thank you, Glenda, I gotcha. Let me know again. I think I got through everybody, but if you are still out there and you'd like to be connected to a breakout room, breakout room number 1 is long-term care facilities, assisted living, home health. Gotcha, Darcy. Thank you. Gotcha, Paula. Sorry about that. Group number 2 are outpatient facilities. Gotcha, Yolanda, I'm coming. Three are the health department. And number 4 is acute care hospitals, acute care facilities, or mental health facilities. Anybody else who was unable to join and would like to, let me know. Gotcha, Leanne. Gotcha, Rochelle.
The skilled nursing facility. Okay. Okay. So everyone's coming back. Okay. Great. So that 15 minutes went really quick. I know we had some good discussion in our room, and we were learning a lot from each other. So I think we'll just take a quick minute or two to go through each of the rooms, just to hear about some of the highlights from our discussion. So I'll go ahead and start with our group, which was long-term care facilities, assisted living facilities, congregate facilities, and home health agencies. And just, some of the things that we talked about, especially, that the universal masking was the most common source control that we're, using in our care facilities these days. And of course, there's a lot of challenges with getting compliance with those masking requirements. But some of the ways we overcame those challenges, were by doing lots of education, PPE demonstrations with Teach Back, in-servicing regularly, leadership rounding, identifying champions on each of our units to help enforce some of those recommendations, and overcome some of that resistance, with family members, encouraging, using language where we talk to staff about, that they're protecting their family members by wearing masks, and just encouraging them to wear masks to prevent the spread of COVID. So those were some of the highlights from our group. So we'll go ahead and pause for group number 2, which I think that was Shane. Hear from you guys.
That was Shane, yes. So our group was the outpatient settings. And so we talked about a lot about COVID source control, and some challenges faced is that, some people think that they don't need to wear source control anymore given the sort of lightening of restrictions. And so, having to kind of redirect them back to wear source control and telling them why it's important for the safety of everyone is a way that's kind of been overcome. In other settings, so another form of source control is the implementation of sick rooms. So to isolate individuals who are in the facility who may be ill or contagious, can be placed in a sick room until they can be moved to, a safe location or out of the facility, depending on the setting. And, in terms of overcoming challenges to people wearing source control, we also talked about having simple messaging using pictures to kind of address issues and concerns that people have. And then we transitioned to talking about N95 respirators. And, it seems like for the most part, folks, are wearing them appropriately based on our discussion. But, in general, they're only used for people who are on COVID precautions. But one challenge that's faced regarding fit testing is determining whether that needs to be in-house versus contracted out. But for those who need to go off-site, sometimes that can be a barrier to getting folks fit tested because they may, clinicians may want to stay on site to see their patients. The other challenge in terms of source control is folks coming into the clinic and claiming that they are asymptomatic, but turning out not to be when they, are further examined. So lots of great discussion from our group.
Wonderful. Thanks for sharing that, Shane. Allison, for group 3.
Yeah, thanks, Jenny. So we were group 3, local health groups and other support organizations. So we actually had a couple great different examples of different settings. So using source control in daily roles. So even in an office setting, making sure you're masking and using hand hygiene. If you're in a patient care setting, that looks a little different kind of as the other 2 groups have mentioned. But we did have some good examples of, for example, industrial hygienists spoke up about ventilation and how important that is. And also, like for Legionella, for example, filtration in water devices such as shower heads or faucets. The biggest challenges our group discussed was re-educating patients about proper usage of masks, when to be wearing masks, and also how to wear them properly. So a lot of patients, wear them under their nose or under their chin, and just really striving to overcome those challenges through re-education and being mindful of your audience and making sure you have appropriate education materials for the audience you're targeting.
Thanks, Allison. And then Crystal, the last group.
our group was covering acute care hospitals, long-term care facilities, and mental health facilities. For our first question regarding the use of source control on a daily basis, again, it's back to that masking our isolated patients, working with our facilities regarding our HVAC and our filtration was mentioned, along with signage and making sure that they have the appropriate distancing. They put little floor stickers on the ground, to mark out that 6 feet. And again, back to hand hygiene and horizontal cleaning. And then reviewing those challenges, it was brought up, about visitors not complying with PPE. And Christina shared a really great story about her experience, as a visitor. She just didn't know. And so we had someone speak up and, they explain the why. So they give them the PPE and then they give them the why to help them better understand. And then, of course, the non-compliance with our staff is just masking fatigue and doing that leadership rounding with a constant reminder.
Oh, those were great examples. And so thank you all for sharing that today. So just want to wrap up in the next minute or so. I hope you had an opportunity to learn a lot today, and would encourage you to share some of those things in the chat box, or if you have additional questions, please let us know. This slide highlights some of those key messages from today. I'm not going to read through all these, but again, hope you had an opportunity to learn something about source control and why it's so important to prevent the spread of COVID-19. Just want to highlight some of our upcoming sessions. As you'll see on the right-hand side, an opportunity to register, and then on the left-hand side of the slide, on the right-hand side of the slide, some of those broader topics covered in Project Firstline materials. We encourage you to share the link for registration with other colleagues in your organization. And again, as you can see, a lot of these sessions are geared towards frontline healthcare workers, so please feel free to share that with those folks in your organization. And this slide highlights just some of those resources available on respiratory protection and source control. And we've also included the website for Chicago Department of Public Health, where you can find additional healthcare-associated infection resources, and then ultimately the recordings for this webinar. We want to thank you for participating in today's webinar. If you have questions or comments, feel free to reach out, or if you're interested in participating with the Project Firstline team, please let us know. Again, before you sign off, we really encourage you to complete the poll that's open on the right-hand side of your screen. The results from that poll help us to improve our future education sessions. For those of you seeking nursing continuing education credits, you can scan the QR code that's on the slide now, complete that required information. If you are not able to complete the survey at this time, a link will be sent to you following today's presentation, and you can share that with others in your organization that are on the line as well. So thank you again for your time today. We appreciate everything you guys are doing to keep your patients and your family members and your colleagues and community safe. Have a great afternoon. Thanks.